October 27th, 2025. I will see if there's any public comment before we begin. Seeing none, I think we can start. And it's mostly about the variances for the camps. We made a determination last year that we would start earlier with this so that we weren't having things go down to the last minute. And so here we are at the end of October, and we're going to start off with the Nantucket Surf School. Okay? No, there's 4 of us.
So, yeah, Nantucket Island Surf School, and they are requesting variances for the ones on the screen there. Maintenance and plumbage, sewage disposal, toilets. I believe that one's running water, $375 for hand washing. Yep. So, I think the applicant's here, if they'd like to speak, or?
Just the situation in Cisco Beach, we don't have running water, as you know. The activity takes place in the ocean, so usually it lasts 3 hours, so it's not like we're there all day. There are porta potties, and we have hand sanitizer, but we don't have, all the sewage and the running water. We provide water for the camp kids, and they usually bring some anyways, but it's mostly having to do with plumbing and running water at Cisco Beach.
We've, John, do you want to comment? We've given a variance before.
Yeah, so I think we were here 2 years ago and then last year talking about these same variances, which the board granted in the past. Will, our inspector, inspected all the camps this year and didn't find any problems, or the inspections all went very well. He was in contact with them about several things during the inspections as usual. And everyone was able to provide everything to meet the minimum standards during his inspections. As you know, the board can grant variances for different things in the recreational camp code. If, enforcement's manifest and just, and an equal level of protection is provided if the board feels that. My comment is just the board, in my opinion, needs to just weigh the risks of the health and safety and sanitary conditions for the children attending the camps, including these variances from the minimum standards. But as I said, the board has approved these in the past 2 years. I just always focus back to the intent of the regulation, which is health, safety, and sanitary conditions for minors attending the camps. So, as you know, several of these these programs 2 or 3 years ago were never licensed by us. So They just were not on our radar, got on our radar, and have since obviously gone through the whole permitting process and everything. And I think that did add several things to those programs in terms of more lifeguards and more of an awareness towards just providing everything that's required, Corey and Sori checks, those types of things, more awareness on medication storage. So from that standpoint, I think it's good to have that awareness especially regarding all children attending these camps and making sure, they're all safe, healthy, and in a good spot, good place to be and play outside.
Anybody have anything they want to bring up here?
Two questions. And before, were there any, in terms of safety record and stuff, did everything go well last year in terms of either, anything related to the variances that you said, was problematic above and beyond the normal everyday type situation?
No, we didn't have any issues. And I mean, this last year was like the 26th year doing it. So, I mean, there always can be like some little bumps and bruises, in an activity, but actually last year was particularly safe because the waves were very small and perfect for lessons. And as far as anything having to do with, we didn't even have to store any medication. None of the kids were on any medication. Most of the kids are, a lot of them are repeat kids, but, same family, as they get older, they come back. But everything went smoothly, and, it was really easy to work with the health department. They were very, generous with their time as far as helping everything, any questions I had. So, yeah, it went well.
And the landlord of the beach, that's the land bank?
Land bank.
Have they expressed any interest in kind of ever trying to work with you folks to, I don't know, maybe set up a different system to deal with some of the stuff? Or are they hands off?
I think their issues with the erosion, I'm guessing, there's a lot of stress as far as like putting any sort of permanent dwelling. And that's my guess. But watching, the erosion from year to year. And in fact, this fall, the parking lot's already taken like a big hit. Even where they put in the new parking lot, that
they moved it back.
bluff between Cisco parking lot and then the Public Pond Road has eroded pretty badly. So, my thought is they're probably hesitant to put anything in because of erosion issues, but I haven't really, done a deep dive with them either.
Okay, thank you.
Yeah.
Yeah, Madam Chair, I was just thinking that if the board did approve this variance, that maybe we could do it for longer than a year if possible, unless there was something that should come back to us. I would maybe ask staff if one of us or myself were to make a motion, what would be prudent, 2 or 3 years maybe. John, do you have any issues with that?
Yeah, the board can set any time that it wants to, 1, 2 years perpetuity. Yeah, the board can do that. So obviously up to the board. And, if you need or would like us to report back in 2 years or something, we can certainly do that.
And if I could just add, the camps have been great in working with us, with our inspector. We've received no complaints from any of these camps.
Basically, the board is trying to get everybody else down, has asked for the same thing.
Sorry, can you turn on your mic first?
Are you saying that basically everyone else that has come before him that has asked for the same thing we've turned down?
We haven't really had, no, these ones have been approved the past 2 years. The
Yep.
board has approved these
Okay,
same
okay,
variances the
fine,
past
all
2
right.
years. And Madam Chair, if I can just have one more comment. It's just that, let's see, I think pretty much all the camps here, they just crossed the threshold into being camps, which is kind of a difficult scenario on their part. Definition of a camp is anything that you run over 2 hours a day with 5 or more unrelated people. I believe, and they can certainly correct me, the surf schools are probably 1 hour lessons. Okay. And we were told by the state that even though they're 1 hour lessons, it's a cumulative over the course of 24-hour period. So that was something we had learned. But with that said, it's, they're just kind of crossing into that threshold. And I kind of think that if I was on vacation and I was somewhere, taking kids to that type of a scenario, I don't think being a camp would kind of register in my brain. Of course, with that said, we're the health department, it's our duty to uphold the state regulations, so that's what we do, and that's why, these camps have to ask for variances, so.
So to answer your question, Tom, you could do 2 years, you could do 3 years. I mean, you could put a stipulation on there that, provided there's no, complaints or no problems with the camps, you can continue them for that period of time.
I think one of the reasons for this meeting today was to find a way that they didn't have to come back, assuming nothing changed, year after year after year. And so I would endorse something like that. I just wanted to ask you, do they use the porta potties?
Yeah, sometimes, like a lot of the lessons are only for an hour lesson,
They don't have to.
a lot of times they don't need to. I mean, it's, a lot of times they come with their family. So most of the lessons that, mom and dad are sitting there watching on the beach. So sometimes they come and they stay for the day. They might come in the morning, do a lesson, and then hang out for the day with family. So then, yeah, probably they're using the porta potty, but they would be using the porta potty as a beach goer at Cisco.
Okay, Madam Chair, quick question, another one. Is it, and maybe I can maybe ask it to the room since it's kind of a general, is it a problematic to come before the board each year to request the variances? I mean, there is the opportunity for you to provide us update on positive stuff, not just, stuff that's regulation based. I guess I'm a little, if it's not a great inconvenience to the camps to, come and show up for a meeting a year just to kind of give us an update on what you guys are doing. If we do the same variances, we do the same variances, and
I mean, especially doing it this time of year, it's not, I guess it's the stress is like, what if they say no? And then what? What do I do with my business that I've had for a long time?
Well-
But certainly, taking a couple hours in October to come here and report to you guys what's going on, it's not a huge inconvenience.
Okay, thank you.
I would think that if it's the same, if they're asking for a variance for the same thing every single year, that the thing that they're asking for does not change. I don't know why they need to show back up each year, but
That's how we know. That's how we know, by them showing up and saying, nothing's changed, or in some instances, it might be that there is some positive changes and we're not asking for that because it's off the radar. I guess, I think the increased communication between the health department and the camps, I think it's been positive for everybody. I think that, we've learned a lot about how the camps operate, because you guys kind of operated quietly in the background for years. But as a result, I think some of the interactions have led to better camping experiences for the people, because there's more oversight, and also some things got fixed up. I guess I think communication is good. That's kind of where I'm coming from, that, if it's not a burdensome to the camps to come once a year and just kind of give us the update. If same variances, you'd probably be out of here in a half hour rather than 2 hours. If something's changed, I'm a fan of communication, especially in something where things can change. If Disco Beach washes away this year, you're going to go to a new location. That may present other issues that we, and just the kind of, I support communication, that's all. But I support the camps, but I also support communication between the health department and the camps.
I just want to say something quick. I think the reason why we're looking to try and get long-term was the first year that we were brought into this. Just kind of like what John was saying. I mean, he taught me how to surf. I've been running my business for 17 years. He's 26 years. It was all of a sudden like, hey, you guys can't operate unless you do this. And it was just this huge page of things that we have no idea about. Thankfully, we're prepared enough that we had a lot of the stuff, but there's a lot of things that were brought up that we had to bring up to speed. But that meeting was like end of May, early June.
Yeah.
You got two guys that have been running businesses for over 10 years, 20 plus years. And we didn't know if we were going to be able to operate that year unless we got this massive packet of foreign stuff done. So then after we did get it all done, we got all the variances. It was like, all right, well, next year, can we do it earlier? They said yes. Then it was kind of like, all right, we'll do it in May or April. Where I think then we're like, all right, can we do this in October so we can get it out of the way, so we can advertise? Because again, it was still after the first year. I was like, all right, that was a lot of variances, a lot of unknown. Last year, less variances, medical storage, a lot of stuff that, Will's been going through and being super helpful and educating us with. So I think that's why we're just looking for like the long term. So it's not April. It's like, well, I hope you guys say yes, because then it's a lot less time to fix things. Where October, I'd be happy to tell you how great the summer was, but it's just when it's that close to the season, I think that's what was.
Oh, yeah, no, that didn't work.
No, no, it was,
I mean, that was a painful meeting.
yeah.
Oh.
Well, John, I'm going to ask one more time on behalf of the Department of Health. Am I right that your department takes a look at these camps every summer? Is that correct?
Yes, they all have to be inspected.
They're inspected.
Inspected
Okay.
before they are issued a permit.
Okay. So it's not like nobody's looking at anything.
No.
And I think I heard you say when you opened that you feel very comfortable with how things are going and with the plans that are made for sort of working around they mostly are all bathroom kind of issues, really, having to do with that and how to clean your hands after that and everything like that. So am I right that I'm hearing you say that you feel okay with all that?
Well,
There's nothing that bothers you?
like to see the code met, of course.
There's nothing that
Of course, we're
bothers
here
you,
because,
worries
there's variances put into play here. I think there's certain things to consider. Certainly, it's as I say, kind of with codes and definitions, they're pretty much one size fit all for any type of camp. And as we know, there's all sorts of different situations, 1 hour sessions with children compared to, dropping off at 9 a.m. and picking up at 5 o'clock at night or something. Yeah, if there's a level of, equal protection, I mean, the porta potties I would consider as bathrooms. It would just be, there's no hand washing station, which would be nice. There's portable hand washing stations that are available. Hand sanitizer would also be beneficial.
I think he said they have hand sanitizer. Yeah.
Yeah,
Okay.
I mean, that's
Tom?
up to the board.
You want to?
Yeah, I'm thinking, here's what I'm thinking, floating this to the board. Maybe if we were to do a 3-year variance, but add an agenda item every October as a camp update. or maybe bi-yearly, maybe after the summer, if the inspections are done. And it could just be on our regular meeting that John and Rocky present kind of how the inspections for the camp were, and this is what they're hearing, this is what the camps are saying. And if necessary, maybe a representative from one or more of the camps could, I know it would be the summer and it might be difficult, but maybe they could send an email or something like that, just to brief the board. But I think I agree with what you said, that if it's the exact same variance that they've asked before, that I don't see the reason for them to have to come back. If something changed, if the regs changed, or something came down from the state, or et cetera, or we wanted more information, then the board is obviously free to revisit that at a certain time. So I would make that motion. We'll leave it for maybe other board members want to make a comment or two before I'm ready to make that motion, but that's sort of what I'm thinking.
Well, the thing is, we're saying, come and talk to us in October, and that's the problem. We'll start, thing is, if we just resolve everything in October, I mean, they come, present, they have variances, we do it and move on. I mean, if we're kind of saying we want to talk to you again in October, even though we're not going to review variances, come and talk to us and just present the same stuff and update us. I guess if they're coming in anyways, let's just go through and, just do it.
I think, I'm not gonna put words in your mouth, Tom, but I think what you're saying is you just want a summary of how the summer went.
Right.
If there were any problems, that would be health-related problems, but the variance would stand.
Yes.
Would we ask all camps to come in, or just the 4 that we keep doing every year?
Oh, I wasn't suggesting they should come in.
Okay.
What I was saying is that we should maybe have.
summary.
Yeah, exactly.
Okay,
A summary
summary.
from staff on this is how the camp inspections went, this is what we're hearing, this is any state change, whatever. Kind of, but the variance, if
carry
they were
over.
exactly the same for the camps and nothing has changed, or there was no new information, that it would be a grant 3-year variance for what's as presented.
Those
In our
variances they
packet.
received.
Correct.
Those 3 or 4, whatever, would carry for
Correct.
a period with a yearly update as to how
Yeah.
it went, and if there's any changes in those variance requests.
Yeah, and anything that staff would flag that would obviously come back to the board for reconsideration. Right, and there's zero evidence and,
Yeah, nothing.
these.
It's not based on suspicion. I just want to make sure that we have good
Yeah,
communication.
absolutely.
I mean, the camps have really upgraded a lot and have worked with the Department of Health, so that's not my concern at all. It's just better communication gets better results. So
Yeah.
I don't want to break that chain. We can do it lots of ways, but I don't want to break the chain of communication that has had positive results.
Let me ask one more question. This, again, is to John and Rocky. If there were a health-related problem at any of the camps, not just these camps, any camp, would you be made aware of it?
Yes, they're required to do that. Any injury, they need to submit to us, so.
Okay.
Which
So that
does-
sort of sounds to me that if there's an outbreak of salmonella or something, we're gonna know about it. And so, I'm feeling more and more comfortable based on that sort of, information. So if you,
Yeah, I'm not going to block anything. I mean, if we do 1 year, 2 year, 3 year, it's just that I don't want to break the chain of communication so that some things do fall off on one side or the other. I mean,
well, I think we just heard
and
that they
as
would
long as
know.
as long as we're in a position to, yeah.
Okay. Anybody else? Tom, you ready to structure this?
Carrie, you're generally all right with it?
Technically, I'm all right with that, yes, I'm all right with it. I just, my whole thing is just more about communication, because I think it has had a positive impact for the campers, the camps, and for the health department.
Good, okay, well, getting there. So I would make a motion that we grant, as presented in our packet, what was on the screen before, a 3-year variance for the camp, who's first on the agenda, to Gary's Camp, and that we add an agenda, that the board have an update sometime after the summer season, after the inspections are done, and that any other periodic.
Could you try again?
Oh, Siri's trying to make my motion for me. It might be more elegant that way. Okay, I'm going to start again. Turning into a comedy show here.
You try Alexa.
Yes, we might want to move on to that, or AI or something. So I would make a motion to grant a 3-year variance for Gary's Camp for the first on the agenda, as presented in the packet, what was on the screen before, with any periodic check-ins from staff, and anything else that would come back to the board, and a yearly or bi-yearly update, depending on whatever staff feels reasonable, to come back to the board for an update on how the camp season, inspections, et cetera, went.
All in favor?
Aye.
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 Thank you.
Thanks a lot.
Okay. Number 2 is the Ag Surf School.
I think we're the exact same variances. So, and also, just so you guys know, the next level water sports guy just sent me a message. He cannot get onto the Zoom. He can only watch it on YouTube, he said, just so you guys know. I know there's other people that seem like they are in here.
Oh,
I don't know if he's on the agenda.
Kevin, who can?
the number, the next one down.
Okay.
Tom.
Yeah, next level water sports guy.
He's on the YouTube, though. Do you know
Yeah.
this? I can make him a panelist, yeah, to
Okay,
speak
yeah,
when
just-
it's his chance, yeah.
All right. Do you guys need me to say anything else? I feel like I've kind of said everything.
It's the same motion.
Yeah, it's all the exact same
Acceptable?
stuff. Yeah.
I would make exactly the same motion for
Yeah.
Ag Surf School.
I'll ask my same question. Were there any issues or anything, from your perspective at the camp that
No.
everything
no
went
issues.
as predicted and as
Yeah, I mean, knock on wood, keeps going well, so.
good?
I mean, I think the health department, every year it's gotten easier to do this, where it's more just give the packet, make sure you're doing everything right, get the right inspections and everything. But it's
Okay,
going
good.
fairly easy, I think.
Okay, thank you.
Okay.
You want to try to say that same motion again?
No.
Maybe we'll get Siri to help.
Yes.
Ooh, maybe she's gonna hear me under.
I would make the identical motion for the previous agenda item for Ag Surf School. I'll repeat it if.
We'll capture it in the minutes if that's okay with you.
Sure, okay. So I would make a motion to approve a 3-year variance for Ag Surf School as presented in our packet and as presented on the screen, and with any periodic updates from staff on any new info, and also adding an agenda item for the Board of Health to update the board after camp inspections have done, so that the board can have a check-in.
I second.
Great, all in favor?
Aye.
Aye. And who's next? Next level?
Okay, yeah, let me,
Thank you, guys.
Thanks again.
okay. I think I have you on the phone, John.
Hi, everyone. Yeah, can you hear me?
Yes.
How's everyone doing?
Sorry, can you just identify yourself for the record, John?
Yes, this is John Beery, owner of Next Level Water Sports. Sorry, couldn't join in person, but happy to be joining remotely. Can everyone hear me? I see on the YouTube it's switching to my number, but it won't let me join the actual meeting.
We can hear you just fine.
Great. In terms of the line of questioning, so we have no changes from prior year. We had an awesome year on the water. Lots of kids came out, learned boating safety, water sports. We had no safety incidents. Our inspection with Will went really well. So we've made no changes from last year, had a great year, and are open to any questions you guys might have. But yeah, we're here hopefully to obtain the same resolution as both Gary and Gavin.
Hi, this is Carrie. So at the meeting in March, one of the things we had the discussion back and forth a little bit, and one of the questions we had asked was that data from the year about cancellations, illnesses, and injuries. You had talked about how you debrief the staff every day. And we had said, and
Yep.
we just thought that would be information that would support that things are working.
Absolutely. We had about 4 days this summer that we had to cancel. So we normally run Monday through Thursday. So for the days that we had to cancel, we just told parents, would you guys be able to come on Friday? And for those days that we had to cancel, everyone came out on Friday, or if they couldn't, we refunded them. And then we didn't have any instances of illness or any issues during camp. Obviously we had some bumps and scrapes, but dealt with just Band-Aids, no major incidents or anything like that during the year.
Okay, thank you.
John, do you have any comments on this particular? It's a little different. It's not exactly the same.
Right, yeah, this one includes the emergency, the medical facility, the infirmary, and the shelter aspect for campers. And the applicant can correct me if I'm wrong, but I believe they have a pop-up tent which they put up on the beach, or they operate from the town pier. I just want to make sure those things are in place as especially with a high-risk activity like this, that children that may suffer an injury or something have a designated area to go where they will be cared for until the parent can pick them up. As well as I know there is a contingency plan in place in the case of thunder and lightning, but if the applicant could go over that in terms of shelter, that might be relevant as well.
No, 100%. So yes, we're operating out of town pier. We have that collapsible tent. If we do need to bring someone out of the shelter or out of the sun, we keep that pop-up tent, which Will inspected. So that is our portable shelter. And then in terms of inclement weather, that's our policy. So we depart out of town pier and we're doing a daily weather debrief. It's what our lives are, monitoring weather. So we're using a storm app, which has live radar, which we're continuously monitoring. We're monitoring the short and long-term forecast. And then every coach is equipped with an app called the Lightning app, which gives immediate updates if things are moving in on radar. So we have multiple levels, but we have that portable tent, which has worked for several years, and then the option of going back to town pier to shelter in place. But our best bet is just to cancel. So if we see any sort of inclement, edgy weather, we just cancel for the day and either attempt to reschedule or move it to a different day.
Could I ask, I think I may have seen it and not remembered, but what type of medical, first aid, training any of your instructors or helpers have?
Yeah, for sure. So everyone on our staff is first aid CPR certified. We have a lifeguard on staff. We all do our concussion training, and then additionally, everyone has captain's licenses. So around first aid CPR, everyone is getting certified and everyone's trained. In terms of medical resources, every single boat that we have is equipped with a first aid kit, smaller first aid kits, and then our large boat, Motor Vessel Freedom, which is kind of our mothership, has the Red Cross Type B kit, which is much larger. So we have a lot of medical supplies on the water, and then everyone's trained on how to use them.
And about how many kids are participate during your sessions?
So we are typically maxing out. It's about 14. We run at a 2-to-1 ratio is our goal. So 14 students, 16 students is where we are full up.
2-to-1 meaning one instructor for every 2 kids?
Correct. That is our goal as a ratio. Occasionally it bumps up to 3-to-1.
Hi, it's Mary Lepre. Sorry, I was late, but I couldn't participate in the other ones anyway. I had a question. So did you say you have one lifeguard? I mean, are all of your staff trained to be lifeguards?
No, not everyone. So the requirement in the rules is, I believe, 30-to-1, and we're never hitting that 30. So we have one formally trained Red Cross lifeguard, and then the rest, everyone does training, but we stick to that ratio with the first aid Red Cross lifeguard training. So we're covered from a certification perspective, and then everyone does training independently, be it boat training, how to rescue someone. But no, we only have one formal lifeguard, which covers our ratio required on the water.
But that person that works every single day, the whole day, I guess you don't have a backup person, more than one person?
Actually, no. So this year, I misspoke. This year we had 2, and that's where I think having 2 in case someone is sick is smart. So I would be open to that. But yeah, no, this year both Liam and Jake had that, and they were on the water because it's only 4 days.
This is Carrie. So you have lifeguard training. Are any of the other staff have any other types of more advanced training, related to water safety, et cetera?
Our onboarding process. So again, everyone has a captain's license, which is a Coast Guard requirement. So everyone does that formal training. So it's either U.S. Coast Guard captain's license or an international equivalent. And then our onboarding process is extremely exhaustive. So we're doing boat training for kiteboarding. We're doing boat training and water training. So how to get someone out of the water on a kite, wakeboard, winging. So we're covering, it's like we have a 13 module training process that's all documented, but that get multiple days of onboarding every year to prove they can operate safely around the water within our training program.
Is there any type of certification attached to that, or is this training you folks have developed?
It's training we have developed combined with looking at recommendations from other entities coaching. And that's kind of the challenge with kiteboarding, is it's a less formalized industry. But we're working with all of the different industry leaders. Like we started our company working at basically the top kiteboarding business in the US. And that's where we learned a lot of our moves. And then I grew up doing junior sailing. So I'm US Sailing Level 2 certified. So we've largely built our own certification above and beyond the required certifications by the camp requirements as well as the Coast Guard.
Okay, thank you.
Anybody else? John, are there any recommendations for the board in terms of any changes or anything that should be put into place here?
I've liked the focus the past few minutes on making sure, having enough staff trained medically in this situation, just because it is I would deem this high-risk activity for water sports. But, as I said, these variances were granted the past 2 years. This bathroom situation's a little different in the fact that they have to travel from where they hold the activities in Pulpus Harbor back to the town pier. So it's not the same as the surf camps that were on the beach that had the porta potties available. So I think this situation's a little different. And in my mind, it's what's the hour range of not being able to access a bathroom, where you consider that, a sanitary situation, so.
John, is that a question you're looking for a response to, or?
That's up to the board members.
Yeah, I think that worried us, or we thought about that. I remember, thinking last year that was a very long way if you had a kid with an emergency of some kind that related to their digestive tract or their urinary tract, and wondering how that would sort of play out. We obviously granted the variance last year. How does that play out, John? When somebody, because I'm sure in the course of a summer, there is some kid who has an emergency that needs a bathroom.
No, absolutely. So if it's a number one, obviously they're in the water. They're in wetsuits, so it's completely identical to the surf schools. And then if it's the second scenario, so we're talking, when we're bringing campers in, we're talking to them, we encourage them to utilize the facilities. If there is a situation, we have the ability to load up, head downtown, deal with the situation, come back. But our final fallback option is our WAG bag option, which is a portable toilet, it's a portable toilet with gelling bags. It's what's recommended by the National Camping Association, various different parks. It turns the waste so you can dispose it in trash, but we have that fallback option. And that's really where it's fallen out. And if there is an emergency, we can take a child off to a secluded area because of our coaching coverage ratio. We're able to watch the kids, and it just hasn't proven to be an issue in terms of multiple kids needing to go. We've been able to manage it, mitigate the risk, but between having kids go before they arrive and then being able to transport, and then in emergency, we have a third fallback option. Our coverage has been pretty thorough and it hasn't proven to be an issue.
So let me just be clear. If they have if they have to poop or throw up, you take what has arrived and you put it into this special bag?
No, there's literally a toilet they can sit on that has
Oh,
an
okay.
attachment. It's literally a bag that they go into. The bag is equipped with wipes, sanitary wipes. It is designed for camping and going to the bathroom in the wilderness. So
Oh,
they
okay.
literally have they can sit on, and they go right into a bag. It gets zipped off. They're able to wash their hands. It's actually surprisingly comfortable. But yeah, it's thoroughly designed, and they're able to go to the bathroom and handle it all, and it's all clean, humane, and professional.
So you could take a camper into a more or less private place and allow that to happen, is I think what you're saying?
Exactly. We separate them from the group, take them to a private area, they go to the bathroom, and then we come back.
Okay, all right, that's really good to know. Any other pieces of this? Carrie, you're very
No.
quiet.
I asked one or two questions. I think now for this one, I was wondering, we just did the 2-3 years, but, here there's 7 variances. And, are we comfortable with the multi-year on that type of, where there's that many? Or would be more apt to kind of stick to the 1 year so that we can kind of just make sure things are working, because it is a lot of variances. I think we understand the situation. I mean, we've approved it, and I think we are supportive. It's just with 7 variances, I think we might want to keep a little closer watch on it, if that's so. If there's no other question, I'd be willing to make a motion to approve the variances as stated for 1 year.
Did you want to say something, Meredith? It sounded.
Oh, I was going to ask that Carrie put that they have 2 lifeguards, because I think
Okay.
that's important with the type of activities they're doing, that they have 2
That they employ 2 people
who have
who are
lifeguards.
lifeguard certified, not that
Okay.
they're on duty at the same time.
No, but at least they have, it sounds like they might be, but also that they have 2 people, because then there should never be a time where there isn't one there.
Would that be doable, John? I mean, as you said, this last year you had 2, and that was it happened. Could that
We
be
had to.
expected?
We had to. The challenge is, yes, we had 2 this year. We were following the Better Safe Than Sorry protocol. The costs of all these certifications become cumbersome, but if it's what the board wants, these certifications aren't cheap and they add up. But if you would like us to have 2 lifeguards, we can absolutely have 2 lifeguards on staff. But it's where if you have turnover, you end up $200 in the hole, and you're funding that every year. But again, if you would like to, that's what we have to do.
I'd like to. Again, you operate a camp that really is out there doing sports that could potentially be dangerous. I mean, you guys have got a great safety record, so I'm not questioning that, but I'm not sure 2 lifeguards is onerous. I think it's probably in the big, again, you went through this season with 2 and it worked.
No, Carrie, I totally agree. I guess because we require captain's licenses, those courses end up being around $600 to $800 to obtain that license. So when you start stacking up all of the licenses, it becomes very expensive. So if you're looking at like the one required by the U.S. Coast Guard, and like when you factor TWIC cards, drug testing, medical checks that have to occur, it ends up being about $600 to $800 for just that certification. So then again, when you start adding more and more, that's where the cost adds up. But stepping back from all of that, I agree around safety. So if you guys would like 2 lifeguards on staff, we'll have to make that happen.
Yeah, I mean, lifeguards is a Red Cross one. We're not talking about the Coast Guard or any of the higher level. We're just saying to have 2 people who have the Red Cross life-saving lifeguard.
Yep. Got it. So yeah, we can do that.
So I make a motion that we would approve the variances that are requested with the understanding that they would have 2 staff who are Red Cross certified lifeguard. Not expecting the higher level stuff you talked about, but that you would have 2 staff who are certified as Red Cross lifeguard. So that's my motion.
Second.
I'm sorry,
For
but I don't
discussion.
think it's clear that that was a 1-year variance.
Oh,
You didn't state
okay,
that.
okay,
Can
okay.
you redo?
1-year variance approval for the 7 variances that have been requested with the addition of there will be 2 staff who have Red Cross lifeguard certification.
Second.
All in favor?
Aye.
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 Opposed? Okay. That's great.
Thank
That's
you.
approved for 1 year. Thank you.
Thank you.
Thank you.
This is the other one. And this is Nantucket.
Okay, Nantucket Community Sailing.
Good evening. Thank you for asking us to be here. I just want to introduce myself. I'm Emily Taylor, the program director at Nantucket Community Sailing. I've been the program director since 2008, so I'll be entering my 19th season. I hold a master's degree in public health and an undergraduate degree in biomedical ethics. In 2024, I was recognized by U.S. Sailing as our national governing body as the outstanding program director for that year. And I have served and continue to serve on numerous committees at U.S. Sailing, working to ensure that sailing programs are meeting the highest standards in terms of quality and safety, in terms of resources and protocols, having them in place around those items. This work led Nantucket Community Sailing to become accredited by our national governing body in 2015, and we sought and received renewed accreditation in 2023. So this places us in the top 45 community sailing centers in the country, and only community sailing centers can be accredited by our governing body. We're requesting a single variance for our 2026 season from the Board of Health. That variance is, I'll just read the number here, 430.103 regarding supervision and operation of specialized high-risk activities, specifically Section B, which pertains to watercraft. It reads that all watercraft activities shall be supervised by a minimum of 1 counselor for every 10 campers in watercraft, and for every 25 campers participating in watercraft activity or portion thereof, 1 counselor shall be a lifeguard. Each counselor operating or supervising watercraft activities shall have documented in-person participatory training specific to the watercraft activities being overseen. What we are requesting is that our U.S. Sailing Level 1 instructor, Level 2 head instructor, and Level 3 program director, my level instructor certifications, or the international equivalent, in conjunction with the first aid mandatory first aid, CPR, and AED training we do be accepted as an alternative training and certification for our instructors supervising watercraft activities. We believe that these trainings and certifications meet and exceed the CMR guidelines. As I mentioned, we're accredited by our national governing body. That process is rigorous and guarantees that any accredited sailing program meets the highest level of safety and quality standards. Every single one of our instructors at Community Sailing prior to starting work with us comes in with their U.S. Sailing instructor certification, active first aid, CPR, and AED training, which has to be through a U.S. Coast Guard approved provider such as the AHA or Red Cross, safe sport training through the U.S. Center of Safe Sport, and concussion training through the CDC. So for an instructor at my supervisory level, that's 90 hours of certifications that have to be maintained and active every June. For a head instructor, which would be the level 2 U.S. Sailing certification, that's roughly 70 hours. And for our regular instructors at the level 1 U.S. instructor certification standing, that's 55 hours of trainings. These trainings are the national standard for sailors and provide proper safekeeping for students on the water and sailboats. U.S. Sailing has written a letter in support of this variance. Once again, they're our governing body, verifying that they believe that their U.S. Sailing instructor trainings are better suited for the purposes of sailboat rescue and recovery than the lifeguard certification. These courses are additionally recommended by our top insurer, Risk Strategies, which we use and other major sailing organizations use. And these certifications provide person in the water, PIW or MOB, man overboard rescue training. They would provide training in rescuing and recovering capsized sailboats and sailboats that need hands-on the water assistance. They also provide training in proper powerboat handling, towing, and safety when operating small watercraft in and around MOBs and PIWs or capsized sailboats. And these trainings specifically focus on the offshore boat-to-boat rescues that we're doing. Additionally, and very importantly, I want to stress that all students and instructors at NCS are always wearing PFDs, personal flotation devices. So that's a major difference for us, is that no one is ever on the water without a PFD. Our goal is to continue to work with the town and Board of Health to ensure we can provide safe and positive experiences for our sailors and meet state objectives. And we look forward to doing that. I provided a chart that deconstructs the lifeguarding course and how those different skills are already covered in our U.S. Sailing trainings, as well as first aid and CPR coursework. Those trainings that we come in with are additionally supplemented by a 30-hour NCS instructor orientation that I run, which includes a major presentation on water safety, which I also included. The major issues we're dealing with are capsized sailboats, which leads to people in the water, obviously, and entrapment. And really focuses on, once again, those offshore boat-to-boat rescues with people wearing PFDs. So the result is that every one of our sailing instructors comes into an accredited organization that has every instructor with 55 to 90 hours of training through U.S. Sailing, so certification, first aid, CPR, and AED training, and then our NCS orientation, where we're following up and supplementing in all those areas, including with water safety. And I'm happy to answer any questions.
Comments?
Thank you for this chart.
Yeah, no, it actually was kind of, we had a lot of discussions last year about trying to understand the comparison between the two. And
It's nice to see the two things and
Side
the
by
skills
side.
that are in both.
Yep,
yeah.
Thank you, guys.
yeah. Helpful for us as well.
You had a good season?
We had a great season. Yes, thank you.
Good. John, are there any concerns from the health department's perspective?
Well, I mean, just under definition of lifeguard in the code, this particular program isn't one of the programs recognized. And to my knowledge, as of now, it's not approved in writing by the department, which would be Department of Public Health. that contains all the minimum requirements that they look for. So that's my only comment in regard to the regulation.
I guess you guys heard what happened with the people before you. There was a question about having some people take the Red Cross course and become certified Red Cross lifeguards. Is that something that is not, I mean, I understand what you're saying. I've been in this world my entire life. But is that something that just you couldn't check off a box there and get a couple people certified so that it would meet the state requirements?
So when I put together the chart, I was interested in the skills that were being taught in the lifeguarding course and realized in my thought is that those skills we already have that training and we're already certified in that training. And furthermore, the lifeguarding course isn't really teaching us the boat-to-boat offshore rescues specifically for people wearing PFDs. Like that's not something they're covering in the lifeguard course, and that is when and where we're seeing emergencies. So for lifeguards to be on shore with, even if we take the open water lifeguarding course, which is the skill set I outlined there, as opposed to the pool lifeguarding course, it's just different scenarios. And I feel like we have the training that is covered in the open water lifeguarding course. And I've spoken with Harbor Master Lucy. I'll bring her into orientation this year just to be extra sure that if she's already planning on coming to our 30-hour instructor orientation this year, just to be extra sure that if there's something on there, if she can further assist with feedback on hands-on, boat-to-boat, offshore, when people are wearing life jacket rescues, we have that covered as well. So I feel like we have the training covered in what we're doing and would like it to be recognized as such.
What does everybody think?
My thought isn't about saying yes or no. My thought is just it would be really kind of nice if the Red Cross and the two organizations would kind of understand, so kind of like say, yeah, we understand what the training they're getting is equal, because we're kind of like, the charter's great, and thank you. It would really be nice at the organizational level, there'd be kind of like a communication and a recognition that, the people receiving this, we have these skills covered, plus, so like I said, the open water type skills. But I think I personally don't have any questions. I mean, it's the same request as last year. We granted it. You've given us more information. Essentially, the information you've given us this year is the questions we asked last year, kind of in discussion. So to have that in front of us, including the PowerPoint presentations and everything about what's covered, and is really helpful for me, I know. So.
And if I could just say, as a medical provider myself, I've looked at the comparison and I feel the skills there are comparable.
I do think also that there is, if I'm not mistaken, a clause that says if we find that there is a comparable something, didn't you send that to us, John, last week?
Well, in terms of issuing a variance, it would be that an equal level of protections being provided.
Exactly, yes. Yeah, I knew, I wasn't sure quite how it was worded, but I knew that was a reason to be able to issue the variance if we felt that it was equal. I guess now we come to, there are two issues here. One is the variance itself, and the other is, do we extend it for more than a year? Or are we going to stay on the 1-year plan?
I'm comfortable with more than 1 year because I think that what they're doing versus the lifeguard is the same. They're and geared, excuse me, geared more towards being on the water and not somebody struggling in a pool.
Also,
my-
they have not just, they're not just a startup. I mean, they didn't just begin this last year or this year, yeah.
Yeah, and, I mean, the thing is, they've done the extra work to provide to essentially answer the questions that we had asked last year about understanding the training that your folks and you're giving your staff, and also what is the difference between a lifeguard and the higher level U.S. sailing training. So, with the single variance, I'm comfortable with a multi-year if everybody else is. I mean, someone make a
Tom, you're hearing this
motion?
for the first time.
And you missed this.
We do that, been doing this for a couple of years, so is there anything that strikes you that you wanna?
No, what's in the packet is very good and very thorough. And if staff and 2 medical professionals who've been in the field have no issue with it, then I certainly have no issue with a multi-year commitment for the variance. And I'll let Carrie make the motion.
Okay, make a motion to approve Nantucket Community Sailing variance request for a 3-year period. And then it gets to that part about we'll get a report, just kind of either whether it's through the health department, you folks showing up, just to kind of an update, each year, just to kind of, so we know what's going on with camps. So whatever that wording was on the first two, I think would be the same for this one, which is 3-year. And at some point, there'll be a exchange of information.
Second?
All in favor?
Aye.
Aye.
Thank you.
Yeah, thank you.
Okay. Wow. Is there any other business of any kind? Can we adjourn?
Motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Yeah, thank you. Oh, well.
Well, and you like to speak with the first two?
Yeah, I mean, didn't really.
To make sure they didn't need you to be here to speak, and then I had to stay for the game. But I left and it was 18-19. So, we'll see.
Do you guys know Paul Budzinski? Passed away today.
What?
Just found out.
Who's that?
He apparently a burst appendix and died on the way to the hospital today.
What?
Who's that?
Paul Budzinski?
I don't know who it is.
He wasn't that old.
No, he was, I doubt even 60.
Oh,
Yeah. It's really sad. He is a great guy. He's a veteran. 2 kids. Yeah, it's screwed up. Budzinski, yeah. Well, that's what,
he died
that's
of
what's going
sepsis
on.
then.
That's what's going around. That's what I don't think anybody really knows.
On Nantucket?
This was like 3 hours ago. Maybe this morning.
Did he work at the school?
He did for a while, and he was just training to do school bus. He worked he did HVAC for a while. His daughter is Isabella, probably just out of college, and Griffin is probably 16 maybe, the son. And his ex is Caitlin Marcoux, right?
Oh, okay.
Yeah.
good too.
Sad.
Yeah.
Thanks for bringing the happy news.
Yeah.
Good ending.
A bummer.
Be interesting.
Good night. Yeah.
I know two people that need COVID shots. How do I get them?
So what we're gonna do is we're just gonna have them, connect with
To the
Aaron.
nurse's room.
Yeah, and so we moved the nurse's room up front, so we're, John.
So I told one to call.
Make sure he or she calls first because Erin sick and she had to go home today. So until my license situation gets straightened out, I can't give the vaccine to her here.
I told one of them to call and then the other one to call.
Yeah, tell her to ask for Erin.
Okay. Oh, if he's still children.
That doesn't sound fun.
No, this didn't happen, but probably can. So if you're really lucky, you get it all over your body. It's awful.
Like a hard pass on that one, yeah.
Hey. Oh my God, thank you. I would have walked right out. That's it. Okay. Well, that was.
Good night, guys.
Good night.
Bye, John.
See ya.
Good night.
Have a good night.
That was relatively. Something. That doesn't sound. Oh, they know. I don't know if they know.
So I get outside and the window was not through.
The wind?
The window was, I walked two steps out of my truck and I thought it was gonna blow away.
Oh, was it windy? I don't.
Some angel walked right up and grabbed me.
I'll walk out with you. Here we go. Those are cool. Thanks. Mhm. $197, right, John?
Yes, yep. Yep, it was good.